computer. And here we are. Welcome, ladies. Thank you for joining Empowering Seniors Daily Dose. I'm Catherine Ambrose in Wichita, Kansas, and I think most of you are in New York. Is that right?
Yes.
Okay. And this all started with a Facebook group. And Vivian, you started the Facebook group, or you and one other person?
My sister and I started a group.
Okay. Could you tell us what prompted that?
When my mother was supposed to go home and ended up in critical condition with a collapsed lung, we didn't know what was going on. We didn't know how she went from being well and going home to in critical condition in the emergency room. When she passed away 2 days later, my sister and I were like, were we the only ones that this happened to? So we were trying to find members initially of the facility where she was at, just to compare notes with them to see if other members of their families had died as well. So in searching for them, it actually expanded into something more nationwide.
Okay. And did they ever say that she had contracted COVID?
They never told us. We saw her, we heard her over the phone with some of the symptoms, but at the time we weren't really aware what those symptoms were. So when when we thought she was going to go home and then we lost contact with her, that's how ill she was. That's really when we started pushing to find out answers as to what happened to her. So we didn't find out it was COVID until she was in the emergency room and they tested her. On the second day, we found out she was positive.
Okay. And what city was that?
That's in West Islip, Long Island.
Okay. And so you start finding out that a lot of other families were having the same kind of mysterious outcomes.
Initially, we thought we'd find a handful of families. We didn't know about our governor's mandate to include COVID positive patients in these facilities. So we were kind of blown away when this became hundreds and thousands of people. So it's just been like mind blowing.
And so where I'm at in Wichita, Kansas, in our local area, we've had a few outbreaks in nursing homes, but by and large untouched compared to your area for sure. What we can definitely relate to is being separated from loved ones that are in some type of senior care living environment or a care facility or being hospitalized. And right now my father-in-law is in ICU in a hospital. Luckily, since things are lifting a little bit here, he's able to have his wife with him for a few hours a day. But that's still very stressful because it would be better if, one or two of their children could be present too, to kind of just help listen in. And I'm a big believer anyway that when you have a family member or loved one in the hospital, that someone needs to be an advocate for them. I mean, that's my personal belief after what I've been through with family members and what I've witnessed. And I just think that people need an advocate and they need their family around and checking on them. And it's very depressing too to, I would imagine to be in the hospital and have no one around, and so distressing for adult children all over the country being separated like this. And it looks like you've really created a movement that has been spreading nationwide now. And so I'm really thankful that you're on this call.
You're welcome.
And Tracy, how did you get involved?
My father was put into the same facility as Vivian's mother on March 19th after neck surgery. He was there for 11 days, but during that 11-day span of time, his care was terrible. He was sitting in his waist for hours. He was made to eat like a dog with his face down in a dish because his aide wouldn't help him. And he didn't even have his teeth brushed for at least 5 days from what we gathered from him. So when we got him out, he was in really terrible condition. He had sores all over his feet. He was swollen. I mean, this was a man that was a referee. He was a big, burly guy, very healthy. They wouldn't have allowed him to get a 5-hour neck surgery if he wasn't a healthy man. And he came out a shell of himself. I didn't know this at the time, but they suspected him of having COVID because his blood oxygen was low and he was running fevers, although they lied to us and said that he was not running fevers and that the oxygen was probably because, that's standard after having a massive operation. But we got him out and they released him. They released him as a COVID suspect. It was on his paperwork that was buried in an envelope. They did not tell us because I would never have brought him home to infect all of us. So we ended up, my mother, my brother, my boyfriend, and myself with COVID. Sadly, my father died about 2 weeks later on April 14th. And when I saw Vivian, it was like just a divine moment where I read this story in the local newspaper about Vivian and her sister starting this group. And I saw it was the same nursing home. It was just divine. I just reached out right away to her. And I can't thank her enough for doing this for all of us.
And your family recovered?
Thank goodness, yeah, with the exception of my father. Let me tell you, I'm a young, healthy person, a gym goer. This was brutal. It took me 4 weeks to test negative, and I'm still having some health effects in my joints and in my muscles that even though I'm negative and not contagious anymore, I never had these issues before. It's a brutal disease. My mother almost died. She's 73, but luckily she survived because I couldn't take losing both of my parents to this. But by the grace of God, we're all okay.
Well, I'm glad to hear that, and my condolences.
Thank
for
you.
Your father and Vivian for your mother. And Joanne, where are you joining us from?
I'm in Rochester, New York.
Okay. Now, are you Vivian's sister?
No.
No. Okay.
That resemblance, huh?
I wouldn't mind it though. I'd be good with that.
The Facebook group sisters now.
Yeah, absolutely.
Let's hear your story, Joanne.
My story, I have a father and a stepfather that are in an assisted living facility here in the city. And I found out about Vivian and Voices for Seniors through the receptionist at our facility.
Oh,
I was
wow.
I was constantly calling and questioning. When the facility was open, I would go there twice a day and advocate for my parents. So as soon as she told me about Voices for Seniors, I immediately went on the Facebook page and started reading everyone's stories and was absolutely outraged, heartbroken, mortified. There are not enough words to put. And once I went into the Facebook page and started reading the stories and started talking to my neighbors and friends, people started calling me and coming to me and telling me stories about their loved ones here in the city and what's going on with them. Most recently, I have a neighbor next door to me. Her mother is COVID positive in a nursing home here, and they have not allowed her to see her. Not through a window, not through a Zoom. My neighbor across the street came over last night, and he just lost his uncle in a nursing home to COVID. So
continue. I'm sorry.
For us, it's a matter of we're blessed that my father and my stepfather are healthy and they're in an assisted living facility rather than a nursing home.
Mm-hmm.
But for us, our separation has been since March 8th.
That's a long time.
Yeah.
So tell us your understanding of a nursing home versus an assisted living and why that might be meaningful.
Assisted living is private pay. It's not Medicare or Medicaid. Nursing homes accept Medicaid and Medicare. Assisted livings here in our community do not accept that. It's all private pay.
And when some of these facilities that have Medicaid, I would imagine that they keep their costs down so people are in much closer proximity. And that's why we see more outbreaks in the Medicaid nursing home type facilities because.
Correct.
Yeah, this was
Yeah.
just also unexpected. And certainly the shutdowns and trying to keep people safe in the hospitals and in the senior living communities and in these different facilities makes sense, but then also it's terrible because of the separation And because you can't witness things, and like Traci Ann mentioned, things being in a file that you're not even aware of. And even when you get really good care, what you think is really good care at hospitals, our family's experience is that every single time there are things in the notes and there are things that we just weren't told. And that's why it really helps if you're a patient, if you have a family member or caregiver that is really looking out after you. And even then you're just not told the truth all the time. It's unfortunate, but that's just our experience. And so what kind of conclusions, if any, have the three of you and your connections started coming up with to make things better?
I think transparency is a major issue. You alluded to not being told the truth. I mean, we would visit my mother every single day. So anything that came up in regards to my mom, we were on top of it. We either addressed it with a nurse, addressed it with a doctor. When they shut the door, she no longer had an advocate. And I argue that, part of the patient's rights in these facilities is to be aware of their, and participate in their decision-making of their care. In my mother's case, and I think maybe even Traci Ann's case, I'm not sure, my mother didn't know there was COVID. In fact, days before she started becoming sick, which we thought was abdominal issues and attributed to her getting like a cold, she says, "You guys are hiding something from me." She was telling my sister, "You guys are hiding something from me." But she never told us what she was seeing in the inside. So we think that she saw people dressed in PPEs. They probably separated her and put her in isolation. And I wish she had, given us, fleshed out the details, but she didn't. And now I'm thinking that she knew something was going on, and we basically were in the dark. And she was in the dark. She was never told she was exposed. She was never told she had it. Had she known, she would have told me. Had I been informed, I would have been advocating for her. But they kept her in the dark. They kept me in the dark. And it's almost criminal that my mother died not only shut out from us, but she got a deadly virus and wasn't even told, much less her family being told. So we couldn't even advocate for her. It's a terrible thing.
It's shocking. It absolutely is shocking. And it just seems like an impossible situation right now, because this is really about the worst thing that we could ever imagine, being separated like this. And at the same, on the same hand, you can understand why they're trying to keep the community safe. I mean, what are your thoughts on that?
I don't necessarily agree with that. I did in the beginning. In the beginning, I did when they shut everything down. I was upset because our facility shut things down 2 weeks before everybody else, before we even had a case. But my feeling on that is that we shut everything down, but now let's take a look at what's going on in our world now. We've got people out in the streets protesting in hundreds of thousands. We've got people going to the bank, the grocery store, our local stores, our gas stations, and then they're going in and taking care of our loved ones. So for me, I see it as our officials, our governor, see our families as a threat. Why can't family members go in with a mask on? Why can't a family member be tested, put a mask on, a shield on, and go in and sit 6 feet away from your loved one? So I don't think that that's how we protect them. I think that we're doing them more a disservice by saying your families can't come in and advocate and see what's going on and be your voice.
I agree. So what are your thoughts about how to change this so that we don't continue to suffer like this and have this happen to us in the future? Because I completely agree with you that they need to have their family members.
I think that I've been calling all of our local officials, our county executives, senators, legislatures. I've been interviewed by the news station twice. And it doesn't matter how much you pound your fist and stamp your feet. I don't think anything's going to change in our nursing homes and for our seniors until people become outraged and stand up and not only hear their voices, but see our faces. the regulations that New York State goes by, they need to be changed. If you look at in our regulations, it's 1 aide to 40 residents. 1 aide to 40 residents. 2 aides to 41 to 80 residents. And think about that. That's for residents that have serious medical conditions that need help. One person can't take care of 40 residents. And then you add on to it a pandemic. Those rules and regulations in New York State, how we regulate our nursing homes and our assisted living facilities, need to be changed. And until people speak up and demand that we have those changes and what needs to be changed, the Department of Health, you call them and you file complaints. They come in, they look, they call you, they send you a letter and say, well, we couldn't find anything. It's a vicious circle.
Yeah.
And the sad part is that people don't realize that God willing, we're all going to get old, God willing. Mm-hmm. And do we want to be treated that way? Is that what we want for ourselves?
Right. I don't think anybody would want that. So does your group have plans and ideas on how to work together to try to drive change?
Tracy, do you want to chime in or you want me to go ahead?
Sure. I mean, I'll chime in. I've been very big with the reform because I'm pretty active politically, and I've been reviewing the laws, both state and federal. I think there needs to be overhaul at both levels, because the last time we did anything federally was 1987. So this is definitely an issue that we need to address, and reforms need to be made. Now, a lot of these nursing homes, sadly, these people go for a little course. They never get any more continuing education. The nursing homes don't pay as well as a hospital, so your quality staff are going to hospitals. We need incentives to attract better quality employees. We need more, certainly, like Joanne addressed. We need better quality as well. And we also need reforms in place, because this isn't going to be the last outbreak or pandemic. We need other protocols in place that are made up. We need a committee made up with family members, patients, doctors, legislators to come up with common sense reforms. I mean, here in New York, we had the USNS Comfort that was not used. I think that maybe they had a couple hundred patients on it. And we have auxiliary hospitals, which the government spent hundreds of thousands of dollars on. Not one patient in any of these hospitals. So the COVID patients going into the most vulnerable population, it just makes absolutely no sense, and it can never happen again. And we have to drive that reform and keep being pests until they change things here and everywhere.
Speaking of being pests, I would think that there are a lot of people that would prefer to keep the families out of these facilities and out of the hospitals. It would be a lot easier for them to do their shift if there weren't family members asking for, what they think they should be getting, and they weren't witnessing everything that's going on. And I think there's a lot of incentive to keep family out. I do know a number of medical professionals that they're just as heartbroken over this. And, but overall, when you think about the bureaucracy of the whole thing, that it's really nice not to have people around. I think about years ago, like going to gymnastics class, sometimes they wouldn't let the parents watch, or swimming lessons, and that has changed. But, they would say the kids do better if the parents aren't there. I don't know, that just popped into my head. And
we have behind the scenes, we're discussing things, and, with the group, with the inner circle, like, what do we do next? Are we going to have a rally? We actually had a rally in front of Governor Cuomo's office scheduled for this coming Saturday, which, because of the protests, we had to sideline for now, which concerns us, that then the narrative, we can no longer get the spotlight on this issue, which we don't even know, and I'm not sure if we'll ever know, the correct number of seniors that died in New York State alone. So it's in the thousands. And I am sure the politicians do not want us to come back to that topic, but we need to come back and come back with a passion and fury, because this could be my uncle who's 81, my aunt who's 77. It could be my dad who's terrified of ending up in these facilities. He may need surgery, and he's terrified that he would end up in there. And I'm like, Dad, you're not going in there. You have like a hands issue. But my mother went in there for a small abscess, ended up getting stuck in there despite all the efforts of us trying to get her out. So now we're saying, you know, I don't want to be one of those. If things don't change, I really do not want to end up in a facility like that. So we're at a crossroad that if we really become passionate and push forward on this issue, we may in fact see some changes. But if we go back to status quo, these people were elderly, like a disposable culture kind of mentality, then we will not see any change and things will continue. And I'm sure that that's how governors and politicians and some of these private entities want to keep it.
So what kind of response have you gotten from your governor's office?
Oh, we haven't heard from him. Have any of you?
I have written everyone. Very few politicians have gotten back to me, but I write them every day now. So I call, I write, but because of the COVID pandemic, it's been a little difficult to get through because some of their offices are not operational. So that may have something to do with it. I don't expect a response. Governor Cuomo put in the budget bill, he put a little provision in there at the last minute to prevent people like us from bringing lawsuits against the nursing homes and holding them accountable. And this law is still in effect. And there are people, we're forgetting it, there are people like Joanne's parents that are still there and their lives are at risk. So when you pass laws like this and you keep the families out, negligence and abuse can happen. It's a recipe for disaster.
Mm-hmm. Yeah, you're so right. And really taking away the voice of seniors. So you really named your group well. What about speaking to, the press? Have you gotten anywhere there? Have you found an advocate, a strong advocate that is trying to help move your message forward?
We've had some really good interviews on Fox News, local New York Times, Newsday, and they have covered my story, Tracy's story, Joanne's story. And sometimes the media, they have an agenda in the midst of our torment. So we actually need to start driving our own narrative and our own story so that does not get lost in the mix. So we have had some successes, but mainstream media hasn't really touched it a lot or not sufficiently from what I have seen. We have I can't even, is it 12,000 seniors have died in New York, or is it 6,000? I'm not sure. Our group should be full just in New York, people alone. And we have a good portion of our group is from New York, but not if we see the numbers of how many seniors died in our state alone.
In most areas, there is groups like senior network groups where there are professionals of all different senior industries. And have you tried plugging into some of those groups and your local Department of Aging or the local area agency on aging, the AAA agencies?
We are, ARP has had talks with us, and I think Tracy put me in contact with someone, and when I called them, they were like, well, we don't really know how we can help you, although we are really happy with what you're doing. But we're still drawing up a long list of organizations that we can tap into and see how we can move forward and have more voices, add more voices to the mix.
Well, I would guarantee you that your AAA and anywhere you live, every county has to have an area agency on aging, and they probably have meetings. In our area, we have a well-attended monthly meeting, and anyone can come. It's open to the public. So you can go listen to the speaker. You can ask to be a speaker. They'd be delighted, I would imagine, to have any of you speak. And you also get an opportunity usually to say who you are and what you're doing, even if you're not a speaker that day. Being really consistent on attending those meetings is something that you could do. And then also look for the kind of private, not really advertised, but known within the senior kind of medical professional level. The other groups that you can join, you can meet a lot of those people at your AAA organizations and really start networking with heart-centered people that love seniors, and that's why they're in the industries that they're in, and they can give you a lot of guidance. That would be my thought.
I think that we are working in the midst of pain. So it's, like we're still trying to, like Tracy just buried her father. I have not buried my mother. Joanne is heartbroken every day, worried about her dad. So we're wounded, but we're still fighting. So I think that, it attributes to like getting a clearer mind. Initially when we started the group, people started flooding in, and I'm just like, it's overwhelming, but we actually ended up getting a lot of solace in our stories and being able to just vent and being able to express our frustration, shed some tears, tell each other that we're having a bad day. So from that aspect, it has been really helpful, especially to my sister and I, and Tracy and Joanne. I speak for them, I guess. And now it's basically, what do we do next? What do we do next? And that's a question I ask myself every day. What do we do next? How can we advance? How we can continue putting the light on this? Because we feel that if we lose the opportunity in light of this disaster, we may never get that opportunity again. So it's really important that we make really good decisions at this point so that we can really get some changes done.
Yeah, it sounds like you guys are all on the right track and you're going to figure it out. And we'd love to help spread your message anytime. And just out of curiosity, have you reached out to the White House since you're on the East Coast anyway?
I have. I spoke to a representative over the phone yesterday, and they said, well, you need to talk to your governor. And I said, the governor will not call us back, will not talk to us, will not answer our questions. So if you're trying to contact someone every day for months and won't even have a representative contact you back, what should you do? So they said, well, we're sorry, and hung up. So we're sorry. Our seniors, their lives don't matter. They, I just don't understand it. I don't understand. And I think it's important to note as well that for the residents that are in these homes now, you have to remember, we utilize the ombudsmans, and a lot of our residents in our community, and my father's assisted living and my stepfather's, they utilize their ombudsman. So she would come in and they would speak, a lot of them, of what was wrong and what they were seeing and what needed to be changed. And she would help to advocate for them. They no longer have that either.
Oh boy.
They have no voice.
Mm-hmm. I think this is one of the biggest things going on in our country right now. It's impacting everyone that has even had anything to do with hospitals. We have had many people that have died or had unfortunate circumstances because they were afraid to go to the hospital too. I mean, this is just so huge and really needs to be tackled. And
but I don't think we're tackling it in the right way. Here in our city, they just started televising that healthcare workers are supporting Black Lives Matters. Okay, I get that, but where are they supporting our seniors? Yeah. Our seniors are dying in nursing homes as we speak. Mm-hmm. My father, my stepfather, I don't know what tomorrow holds for them.
I think you guys should contact whoever's in charge at your local AAA agency, because I think you'll find some advocates once you reach the right people, and they'll welcome you and they will spread your emails. I mean, my first thought is trying to get the attention of the First Lady or Ivanka Trump. And that's just on my mind this morning because our city just very rudely dismissed Ivanka Trump's offer to come and be a commencement speaker for WSU technology. And I just think all this hatred and political divisiveness is so, just so awful. And I think that you might have some advocates there if you can reach them. And so I just applaud you working so hard to get your messages out there. And I think as you recover, from the shock and the immediacy of what you're dealing with right now, you'll definitely be on a mission.
Well, we've had to cancel a lot of gatherings. Tonight we have Lights for Liberty for our seniors that have passed in nursing homes and to advocate. And we are keeping it. We are going to it regardless of what happens in our city this evening. We have agreed that we're not going to let them chase us away. Our voices will be heard.
Good for you, because the rioters and looters aren't stopping, and they're not following social distancing rules. And while many people haven't been able to have appropriate funerals for their family members, there was a big political funeral yesterday. Huge numbers of people attended, and
yeah, it hurts. It hurt. And for my father was an icon for local football, and hundreds of people would have come to pay their respects. I had to have 10 or less graveside. Now, granted, some people showed up that we didn't know, and there wasn't hundreds, but maybe there was 20 people there, and everyone was wearing masks and socially distanced. I couldn't hug my relatives. So when you see something like that, not taking anything away from what happened there, but it hurts. It's like another punch in the stomach that I couldn't honor my father.
And I think it's important to say too that many of our seniors are veterans. They served this country. They went out and fought and protected our country. My father served this country for 33 years. 33 years. And when I sat and talked with him over Zoom the other day, he said, how is this happening? In the 1960s, he went out with the National Guard to protect our city when the riots. And he said, I don't understand.
My father didn't have his military honors. He wasn't, he was he served during the Vietnam War, and he didn't have his military honors. We didn't get the flag. We didn't get taps being played. Nothing.
It's not right. It is not right that our seniors and our veterans who have fought for those people that are walking in the streets right now, that are speaking up and utilizing their freedom of speech, our parents, your parents that passed, my parents that are still sitting in facilities, are the ones that gave them that right. And where are they? Where are they?
And even for those that didn't serve in the military, if you think about it, they built our churches, they built our schools, they built what we have today. And a culture that doesn't honor their mothers and fathers, it's just horrible.
It's sad.
It is sad. And I'm glad that there are women like you fighting for justice. And we don't want seniors or anyone of any age to be afraid to go get the medical care that they need and have poor outcomes because of that. So things have got to change.
Well, and I think one of our members in Voices for Seniors, I'm sure Vivian he stated it best the other day in one of his posts. He said, would we allow this if this was happening in a daycare center? Would we allow this to happen to our children?
Mm-hmm. Yeah.
We would not.
Mm-hmm. We've got to stand up we've got to stand up for our seniors. And so for seniors that are watching, what encouragement can you give to them so that they don't feel marginalized and unheard?
Wow, what a question. I lost my mom, and I think sometimes I could have just packed up shop and just said, okay, let's just heal from this wound. But I think that my sister and I have always been conscious that we are now fighting for the other seniors, the many seniors that we stood actually in front of one of the veterans facilities that lost over 60 seniors, and I was crying. I didn't know any of them, but it broke my heart just imagining the loss in just one facility alone. And, we stand with you. We want to be your voice. If you're physically able, please help us, because this affects us all at one point or another. Obviously, like Joanne said, if we make it to be a senior, it affects us all. So every contribution, whether it's phone calls or sending letters, please join us, because we want to speak for you. We want to speak with you.
That's excellent. And is there anything that you have been sharing with people as you have been having your other conversations that you each would like to leave us with a parting word?
Go ahead, Tracy.
Well, just that, you know, we love you, we care about you, and we will spend the rest of our lives making sure that you're safe, protected, respected, and have dignity. You are valued. You are not throwaway. Everybody values youth and beauty and everything in this society. No, we're here fighting for you, and we're a force. So, you know, hold tight. We're going to get change, and it's going to get a lot better. I'm not going to stop until these places are sanctuaries for our elderly and our sick.
Beautiful. And Joanne?
I think what I tell my parents every day is this isn't forever, it's just for now. And that your life has value up until you take that last breath. And that we will fight for you and we will be your voice, whether we are able to see you or not. We will always be your voice, and we always will stand up for you to make sure that you have not only what you pay for, but what you deserve.
Exactly. Really good.
And isn't that a challenge to know what you what benefits you're supposed to receive? I mean, that's what Empowered Senior really is all about, is trying to navigate through all the overwhelming issues facing families that are age related. And people miss out on so many benefits because it's so complicated and they don't know what they're entitled to.
And I think a huge piece of all this, to not be forgotten, is not only our loved ones that are in facilities or that have passed, but the care and the support that we need to give the families that are trying to support them and that have gone through the pain. I mean, you need that support, whether your parent has passed, whether you're still dealing with it. It's hard because when your parent has dementia or Alzheimer's, your roles reverse. You become the parent, they become the child.
And a lot of adult children are going to have, and spouses are going to have post-traumatic stress disorder from all of their unique and individual experiences. So that was a conversation that I just had with a mental health professional the other day. And so they know that's coming, and it's going to impact everyone in different ways. And even though we're all experiencing COVID-19 and the riots and all the current events together, we're all having our unique and individual experiences. And we come to it with different levels of being equipped to handle it too.
Right.
Correct.
Vivian, thank you for
You're welcome for the invitation.
She's doing a great job, and
Absolutely.
I'm grateful to her. She has changed my life.
And she's going to change, and when this is all said and done, she's changing the life of millions of seniors.
Don't make me cry. Don't make me cry.
No, your parents live on. I mean, for what you're doing, her death is not in vain.
That's right.
And neither is your dad's, Tracy. They're not in vain. And we won't stop until we get justice and make sure that my parents and all those that come behind them are safe and loved and valued.
And Joanne, we certainly wish you good outcome with your family members. And I thank all three of you for being on today. I'll be cheering you on and be looking for ways that I might be able to help. If you have any thoughts on how I can do that from the middle of the country, let me know.
Thank you.
Thank you so much.
Thank you so much.
Appreciate
We're so
it.
grateful. Have a great day.
Thank you.
Thank you again. Have a good one.
Everyone for participating in the Daily Dose. Thanks,
Thank
ladies.
you.
I'm going to turn the recording off.